So let's jump into our first demo. New innovations brought to you by PDI. This demo will be presented by Megha Patel. Megha is the Associate Director, Environment of Care for Upstream Marketing. And now I'll turn it over to Megha.
Thank you so much, and hello everyone. Thank you for joining us today. My name is Megha Patel, and as April mentioned, I'm the Associate Director for Upstream Marketing at PDI. I'm truly excited for the opportunity to speak with you all today about PDI Healthcare and how PDI empowers you to be the difference with infection prevention. At PDI, we're driven to help lead the fight against preventable infections and help save lives. With a 40-year heritage focused exclusively on fighting preventable infections, we're always striving to do more to reduce the spread and preserve the well-being of facilities, staff, and patients touched by our products. Infection prevention is our passion, and it's at the core of everything that we do. Every year, over 1/4 billion people are helped by PDI products and solutions. We work hard every day to earn your trust and continue leveraging the concentrated expertise we've gained to create innovative solutions that help save lives. Sorry, give me 1 second as I move to the next slide. Here we go. So at PDI, we're focused on understanding your greatest challenges and identifying what you and your staff and the folks within your facilities really need. We strive to do more than just provide products. Our layered consultative approach gives you the procedures, policies, and solutions you need to prevent infections, which help you lower costs and at the end of the day, improve your overall protocols around disinfection and cleaning. For surface disinfection and cleaning protocols, PDI offers a comprehensive portfolio of products and solutions to address your needs. And our Sani cloth brand is the #1 brand for surface disinfection within healthcare. By leveraging, again, our concentrated expertise, we continue to build our portfolio of products, clinical support, and educational resources to help you improve your cleaning and disinfection protocols and procedures. Today, I will focus on PDI's innovative solutions to address key needs and challenges within the surface disinfection realm. As we speak to facilities about their disinfection protocols, 3 key needs continue to rise to the top. Disinfectant products must first be effective at addressing the key relevant organisms that facility is concerned about. The question I'll pose here is that disinfection happens at a point in time. Depending on a facility's protocols, it may happen 1 to 5 times a day, depending on the area or the surface being disinfected. The organisms killed are only killed at that point in time, with the surface becoming recontaminated through the course of the day as soon as someone touches it, and it remains that day until the next time that surface is cleaned. Being efficient is also a key need, not just regarding how quickly a product can kill the organisms as they're being applied, but how a product and/or service help you drive efficiencies within your protocols with training staff, with steps needed from the staff to disinfect, etc. Having products and services that are easy to use and easy to incorporate in your existing protocols are also a key requirement. Oops, sorry about that. Jump back to this previous slide here. Here we go. So our first product that I'll touch on regarding innovation is Sani 24. So let's think back to the slide that I just talked about. Today, when a surface is disinfected and organisms are killed, the organisms are only killed at that point in time. So think about a product being used to wipe that surface. That disinfection is happening only at that point in time. 2 minutes later, 5 hours later, or even 20 hours later, I can come and touch that surface with my hands. And if I have organisms on my hands, I have just now recontaminated that surface. that surface remains recontaminated with whatever organisms I had on my hand until the next time that surface is cleaned. This increases the risk of harmful transmission of pathogens until you're able to disinfect and address it. And it's really unrealistic for facilities to follow everyone around and clean up after every single time someone touches an area or a surface. So how do you keep surfaces from becoming recontaminated in between those disinfection protocols and in between those times that you're actually wiping that surface down? Sani 24 is the answer to that. Sani 24 is the first and only EPA registered disinfectant that allows you to not only kill organisms at that point of use, but it continues to kill what we call escape pathogens, which are relevant pathogens responsible for over 40% of healthcare associated infections we see for up to 24 hours. With its quat alcohol formulation, Sani 24 kills 26 organisms with a 1 minute contact time, meaning as you're applying the product in 1 minute, it kills 26 relevant pathogens. It then lays down this antimicrobial shield that continues to protect against several of those pathogens, which are termed escape pathogens, for up to 24 hours with its continuously active disinfection technology. So this quat alcohol formulation is really meant to provide that immediate disinfection with a 1 minute contact time, meaning that in that 1 minute, as you're applying the product, it's going to kill those 26 organisms on the surface. And while it's doing that, it's laying down this antimicrobial shield or this protective barrier that then provides that 24-hour disinfection against those escape pathogens. What we see with standard disinfectants is that they only work at a point in time. So standard disinfectants, what you use today, only work as you're cleaning that surface. Again, if I come in and touch that surface immediately after, I've just now recontaminated it and all the work that you have done doesn't matter. Sani 24, with its antimicrobial shield, continues to protect against those relevant pathogens for up to 24 hours, which is a truly one-of-a-kind innovative technology offered by PDI. We've partnered with Microban International to incorporate this innovative technology within healthcare disinfection products with Sani 24. So next, I'll move to another innovative product that we're rolling out this year. This next offering is Sani Hyperside. So PDI is introducing Sani Hyperside wipes later this year, and we introduced the spray a couple of years ago. So going back to the needs of a facility that I talked about a few slides ago, being able to kill relevant organisms quickly and efficiently is really important. We found that most facilities utilize bleach formulations for their hardest to kill organisms, especially the organism known as Clostridioides difficile, or C. diff for short. While bleach is a very effective formulation to address those hard to kill organisms, facilities often struggle with that residue layer that bleach leaves behind. Bleach utilizes sodium hypochlorite as part of its formulation, which salt deposits are a byproduct of. So if you ever use bleach to wipe a surface, you'll notice this white residue that's left behind on the surface. And that may look very unclean. So if a person walks in after you've disinfected, they may not view the room as being clean. So facilities at this point have two options after they've disinfected bleach. They either do nothing, which again leads to the perception that the room is not clean, or they have to add an extra cleaning step to their already comprehensive protocol to ask their staff to take an extra cleaning step, meaning after you've disinfected, you go back in with a secondary cleaner. Staff has to take extra time and an extra product to then go back and remove that white layer or those salt deposit residue from that surface. And that also requires extra training for staff. So now you're burdening your staff with additional steps, additional products, which decreases overall efficiencies. Sani Hyperside is innovative because it offers the ability to address those hard to kill organisms like C. diff with an easy to use formulation that is compatible. And by that, I mean, it's a ready to use formula that does not leave those salt deposits behind. So you have the best of both worlds. You have a very powerful formulation without the addition of extra cleaning steps required after use. So Sani Hyperside really, with its hydrogen peroxide formula, gives facilities the ability to address relevant pathogens in 1 minute and the ability to kill C. diff, should you need to, in 5 minutes. It is a easy to use and simple to use formula. It is able to address C. diff with a ready to use wipe and a ready to use spray formula with its hydrogen peroxide formulation. What we also see in the industry is that there are other hydrogen peroxide formulations available that can kill C. diff, but they're only available in liquid concentrates. So what that means, again, from an efficiency standpoint, is that staff has to take an extra step at the start of every shift to mix and dilute those formulations before they can use them. That increases the time within your workday. It adds extra steps, certainly, and it requires training to ensure that you're mixing and diluting correctly. With Sani Hyperside and its ready to use and easy to use format, you're ready to go from the beginning without any extra steps required to mix or dilute. We talked a little bit about compatibility already, how most bleach formulations used to address C. diff can leave behind that white residue. Sani Hyperside is more compatible because it has a hydrogen peroxide formulation with surfaces and materials than bleach should be found to help drive those efficiencies. And we can see that in the next slide here. So you can see here in the first and third snippet is Sani Hyperside. So that is basically Sani Hyperside's powerful hydrogen peroxide formulation used to wipe a surface. Compared to the second and fourth slide that you see is with a bleach formulation. So after you've disinfected, right, they're both killing similar organisms. They both have similar contact times. But the difference is with the bleach formulations, staff typically has to go back and wipe off that white residue, which adds extra steps, extra products, extra training, and really drives down efficiencies within a facility. And if you're trying to maximize your workflow, if you're trying to maximize efficiencies and limit the amount of time your staff is disinfecting or cleaning, Sani Hyperside's hydrogen peroxide formula really allows you to drive efficiencies because it's a one and done. You use the product to disinfect, it's able to address the hardest to kill organisms, and because it does not leave behind that residue, there is no need for a secondary cleaning step or a secondary step or secondary product required by staff. So Sani Hyperside is truly innovative because it offers you that ready to use powerful hydrogen peroxide formulation without any extra steps being needed. So with that, I'll open it up to questions. And April, please go ahead and take over from that standpoint. And thank you again for giving PDI and myself the opportunity to speak to you about Sani 24, which is a continuously active disinfectant and the first of its kind within the industry, and Sani Hyperside, which is also innovative with its own regard, with the ability to offer a hydrogen peroxide formula that is strong enough to kill C. diff, but compatible to use every day.
Okay. We do have a question from the audience. Can Sani 24 be used in electrostatic handheld sprayers without PPE being used?
Great question. We currently do not recommend use of Sani 24 with electrostatic sprayers. There is a polymer in there that we're currently assessing to see how it works with that, but currently it is not approved for use with electrostatic sprayers. It is available in a ready-to-use spray format, though.
Okay, we have another question. Does Sani Hyperside leave a barrier as the Sani 24?
It does not. There are two different technologies. So Sani 24 is a quat alcohol formulation, and typically we see it used as a general or daily disinfectant, right? So if you think about a layered approach to disinfection, you want to first utilize, depending on what you're trying to kill. If C. diff is not a concern for you, Sani 24 is the option that I would recommend, especially those high touch, high traffic areas. Think back to light switches, elevators, railings, waiting areas. Those are the areas that we would recommend utilizing Sani 24 in, where you're basically looking for a general daily disinfectant. Sani Hyperside is very different because it's really meant to be used as a sporicidal disinfectant. So Sani Hyperside is a one-time disinfectant that's able to address those hard to kill organisms. You do have the ability to utilize both. So if you want something that's able to address C. diff, recommend using Hyperside, and then you can add Sani 24 as a secondary continuous disinfectant on top after you've disinfected with Hyperside.
Great. Okay, we'll take one more. Is the residual effect of Sani 24 sanitizing or disinfecting?
It is a disinfectant. It's a 24-hour continuously active disinfectant specific to those escape pathogens. So there's about 7 pathogens that it continuously disinfects against.
Okay, great. All right, thank you, Megha. Any final thoughts for our audience?
No, thank you again for listening to our demonstration here today with 24 and Hyperside. PDI is truly excited to have these innovative options and first of a kind products available from a healthcare grade disinfectant standpoint. And we look forward to providing these products for your needs in the future. Thank you.